Going to start our lecture. Okay, so good evening, everyone. My name is Tim Cranton, calling from the College of Remote and Operational Medicine. Offshore medicine. Now I'm going to be in trouble for that. Remote and offshore medicine in Malta. And today's student interest group for the Wilderness Medical Society is going to be on camp sanitation and field hygiene. So if you bear with me a second, I'm going to present my my screen for you. Okay, and if you could feed back to me, guys, can you just tell me if you can see my slides?
Yeah, I can see it.
All good, fantastic. So we've got a change of logo now for the fellowship in the Academy of Wilderness Medicine. So if you are looking for them on social media, there has been a little bit of a change when it comes to their logos and the like. Like I said, this is part of our lecture series for the fellowship in the Academy of Wilderness Medicine. And today I'm going to talk to you about camp sanitation and hygiene. So this is a subject that's kind of dear to heart. This is a picture that I've taken of a campsite or a living accommodation area of some of my younger scouts. So I'm actually a scout leader in the Czech Republic, where I'm normally based. But I'm a scout leader with British Scouting overseas. So I actually spend quite a lot of time in the field because as scouts, we like to go on camping expeditions and the like. But when we have large groups of people, it's very important that we follow some rules when it comes to health and hygiene. And this is essentially what I'm going to be talking about today. So if you have a good look at this picture, this is arguably what you can expect from a youth group who don't necessarily have a level of experience when it comes to how to look after themselves and how to look after any field work site that you may end up in. That being said, I've actually been in field locations where we've been working out of tentage, and we have had grown adults, various nationalities, and their accommodation does not look that dissimilar. And you would argue that you would think that grown adults would be able to look after themselves, would be able to look after their accommodation and where they live. But unfortunately, not everybody's capable of that. And this is knowledge that I feel people should know if they're going to be working in remote healthcare setting where they may be sleeping and living in the field. Here we've got pictures of food debris, we've got clothes, we've got any number of things that are just scattered and unkept, and there is a multitude of issues that this could cause. So just a little bit about myself, for those of you that don't know me. I am a UK paramedic. I spent some time in the UK Fire Service as well, but I'm currently practicing as a remote healthcare practitioner. I was a dive medic, and I'm also a director of my own training organization based in the Czech Republic. I'm faculty for the College of Remote and Offshore Medicine as one of the professional practice advisors. And as I already mentioned, I'm part of British Scouting overseas. I'm a district trainer and a scout leader. And there's a picture of me there on one of our camps in my little clinic that we set up. And I was looking after around 100 people. That includes adults and younger people as well. So it is vitally important that we look after ourselves if we're living and working in the field. Personal hygiene is very important, and it needs to be maintained to keep yourselves healthy. Now, you can't give full attention to your mission or your job or whatever responsibilities you have if you are not healthy. And essentially what we need to be able to do is we need to transition from our normal kind of, I guess, civilian lives where we're living in maybe an urban setting and transferring that into a field setting. But remembering that the amenities and the facilities that we have are going to be extremely limited and may not be similar at all to where we've come from or where we would live normally. So if we are living on what we would call a camp or a site, hygiene and sanitation is important for maintaining the health of everybody that's there. So for likes of myself as a scout leader, it's not just about my health, it's also about the health of everybody else that's at that place. So planning and training is going to keep people healthy and focused on what we would argue as mission objectives. This could be in a refugee camp. This could be in any number of places in the world. Most recently, the British Army deployed to Turkey, where they set up a field hospital. And that hospital was in tentage, but they had to live there as well as operate there. We were in a post-earthquake zone where they were unfortunately getting aftershocks, and they're having to look after a population. And they're not just looking after injuries that have been sustained, they're also having to look after health and hygiene. And that can be especially important when you're looking at water and sanitation, because we need healthy, clean drinking water to be able to survive. So objectives of my lecture today really are to go over campsite living, go over how we would manage waste and look at sanitation, consider personal hygiene and looking how we can protect ourselves from the environment. And we're going to look at some common medical problems as well. Now, for some of you guys, this may seem like very basic stuff, especially those of you that may be in the military or have been in the military. But not everybody has had that luxury. Not everybody has managed to be part of the Scouts. Some of us come from in-hospital backgrounds, from emergency departments, operating theaters, and state-owned services. And to give you a sleeping bag and a meal ready to eat and tell you to go and live in the middle of a forest somewhere is going to be something completely alien to you unless you've had some kind of familiarization and training. And if you haven't, it's going to be a hard process learning. And it doesn't need to be that hard because a lot of that can be achieved through some basic knowledge and some basic training. So the first thing that really springs to mind is waste, especially the human type. So if I'm going to be living in a tent on my own or with a group of people, for myself, I spent some time in the jungle in Costa Rica at a research station that was in the middle of the jungle. And we all need to eat. We all need to go to the bathroom, and we all need to consider what happens to that human waste, the waste that you produce, but also the waste that other people produce. And when we say other people, that's people that you're living and working with. But what about your patients? What if your patients are sick? Imagine that we had patients with cholera. How would you manage that level of waste? Disposal should be decided on the type of camp. I'll talk about those in a second, but we're looking at a temporary camp. So something that's probably going to be there for 2-3 days, usually less than a week. Semi-temporary, again, usually less than a couple of weeks, usually less than a month. Permanent is something like a refugee camp, something that's going to be there pretty much all of the time. And there's special considerations we have to have as well, especially high altitude. If we think of Everest, if we think of K2, Annapurna, we think of base camp. It's a kind of a common expression. But then we get camp 1, camp 2, camp 3, camp 4, depending on the number of stages it takes to make your ascent to wherever the top of the mountain is that you're going. But that waste has to be moved. It has to be got rid of. Arguably, certain places like K2 and Everest, if you go to base camp, the control of waste is certainly a challenge. And there are various pictures that you will find on a basic search on Google about waste on Everest. It's worth a Google. It's surprising what stuff just gets left behind. And to be honest, it's terrible. It shouldn't happen. So in terms of human waste, we're looking at latrines. So a latrine is a term that we commonly use for toilet. So it's somewhere where our excrement, our urine, our feces can go, and this is biodegradable. So the idea being is that we can put it into the ground, but we need to put it in such a place that it's not going to contaminate our daily living, but as well as things like water supply. What we don't want to do is contaminate rivers. We don't want to contaminate streams. But the last thing we want is for human excrement to get walked through living facilities. And that can happen if waste disposal is not managed properly of human waste. Poor flush latrines refers to a toilet where you would have water and essentially you're washing away the excrement. You can have potties. So there's a picture there of an inflator potty. Most of us are familiar with a toilet for going to for excrement, for feces. But we like to sit because sitting is comfortable. And rather than hovering over a hole in the ground, it's a lot more comfortable for us to use something that emulates the toilet bowl as we know it. Ventilated, improved pits. So smell is always going to be an issue. So we need ventilation. So it's not just about a place for it to go, but we need ventilation as well. We need air circulation. We've got a picture there of a straddle trench latrine, and it is literally how it sounds. So certain places of the world, we don't tend to have the traditional toilet as we might get in the West. And there's an expectation where you will squat over a hole. That could be a porcelain hole. That could be literally a hole that you've dug in the ground. But with a straddle latrine, you literally straddle across a trench, you squat over that trench, and you will defecate into a pre-dug trench. You will obviously clean yourself as best you can. So paper covered can, you can see here. There are dimensions that we've included, and there's a means of covering that excrement. So what we don't want to do is leave excrement to the atmosphere, because that's going to attract flies and other vermin. So we want to try as much as possible to cover our excrement, and that's a key thing to remember. We don't like leaving it out in the open. We need to try and seek a way of covering or sealing any excrement that we produce. So of course that's not the only trash or rubbish. Campsite cleanliness, as I've already mentioned, is really important. And we need to think about our environmental considerations. And I already mentioned about things being vented, so that we have any kind of smell. There's nothing worse than being in a camp and that smell of excrement is wafting across the campsite. I actually live next to a farm in the Czech Republic, and it's not very nice when the weather is a certain temperature and the air is not moving very well, and that smell from the farm animals next door ends up in your own yard. So imagine that kind of tenfold if it was human excrement wafting over a campsite. It's not going to be very good. We also need to think about weather as well, because if you're literally dumping it on the ground, it's probably going to end up getting washed somewhere. What we want to do is respect the environment, and I think that's kind of part of the ethos of living and working in the wilderness, especially when it comes to wilderness medicine. And we leave no trace. In other words, anything that we produce, any waste, we make sure we clean it up. It's good for the environment, it's good for the animals, it's good for us, it's good for health, and it's good for hygiene. What we do not want to do is attract any kind of insect or pests, because we know these can be vectors for disease, and we can have rapid spread of disease that can infect other people very quickly. And all of a sudden, we can have a large number of people extremely sick. We don't want to attract any kind of animals, because again, they can bring with them disease. But if we have an animal potentially as big enough as a bear, then that could actually end up attacking people. And we've certainly got instances where polar bears, a colleague in Alaska, and having a conversation about polar bears coming into local communities because they're attracted by waste. And of course, that poses a threat, not just to the animal, but also to members of the community itself. I think, unfortunately, this animal was destroyed in the end, which was a really sad story, when it didn't need to happen. And the animal also had a cub as well. Pack out what you pack in. You take it home with you. If you take it in, you take it away. It's as simple as that. Now, if you're going to be there, especially on a permanent campsite, and you don't have the facilities to be able to pack it out or take it away, then there is rubbish that you can burn. You can actually burn feces, but you need to do that in a very controlled way. But paper trash, it can burn if you have a campfire. But things like plastics, foam, foil wrappers, etc., they do not, and they will only melt. So you may need to partially burn them and also pack them out. Either way, you've got to have somewhere to put them. You need an area where you're going to have bins or some place to put them that's sealed so that those critters, those insects, those animals can't get in there and get access to the rubbish. It's also got to be away from any areas where you might be doing any cooking or any living. If you have a fire, you can burn out things like cans, meals ready to eat, food containers, before putting them in the trash. You've got to think about reducing the attraction of insects and animals. Things like MREs actually contain a lot of foil and plastic, so these things do not always burn. If you can, any wet rubbish or trash can be dried at the side of your fire, and you can do that before burning. So you just need to think about it first. But do not bury trash. Animals are just going to get back up. Any questions so far, guys? Any comments? In that case, then, do not dump your trash or your wastewater into a latrine hole. You've got to keep waste separate. Where possible, we'd like to recycle. Again, it's good for the environment. But we don't want to leave things in place. We don't want to damage the environment. We don't want to damage the environment's population, i.e. the animals and the insects. We have to have respect for that as well. So as I said, don't bury it, because animals, they have very good senses of smell, and you need to make sure that you take that away as much as you possibly can. You need to create facilities as well. So that may mean getting some kind of transport. There's no excuse, really. We can do this. We just need to try harder. So when we say team level camps, essentially we're talking of larger groups of people. So usually around 6+. Each member is responsible for their own rubbish, and they should collect and carry out their own trash, and they should manage it. Again, it's about you being responsible as an individual, first and foremost to yourself and also others. Do not keep the trash, food, or packs where small animals are going to be attracted. Again, you need to think about your equipment, and you have what we might call mission critical equipment. Now, as healthcare providers, the last thing we want is for any critters to be chewing through our IV giving sets or any of the medication packaging. I've actually had rats chew through IV fluids in a location, unfortunately in the Middle East, because they were able to get into containers where medical equipment was, and those containers, storage containers, were actually next to the same containers where they stored food waste. There was poor levels of control, and unfortunately we didn't know until we got into the container and we found medical equipment or medical supplies that we wanted to use, and they'd already been damaged by animals. Any food supplies that you've got, they may also eat those, but also contaminate them as well. Certain critters, certain animals like skunks, they may do more than try to eat your foods. They can be pretty ingenious, these creatures, and they can get into some weird and wonderful places, and they can cause an awful lot of destruction. It's not just about eating your food. They may steal things too. Of course, with any kind of animal, mammal, there's a risk of bite, The last thing we would want is to invite stray dogs or stray cats. Again, that can be, we can have issues with that in certain parts of the world. And when we think about cats and dogs, we can also think about other diseases like rabies. So don't leave your pack out leaning against a tree or unprotected. Your personal equipment needs to be managed. So this can be your sleeping bag, your rucksack that contains your research equipment, or whatever it is that you're doing. You need to make sure that it's in a place where things can't get into it or get to it. Straps that often absorb sweat and salt. Rodents and small animals like to chew those, surprisingly enough. So you need to make sure that your equipment is clean, as well as inaccessible to things that can get to them. It goes without saying that anywhere we go, if we're working in hospitals, we're working in a clinic, etc., personal hygiene that includes hand washing is paramount. There are various ways that we can improvise hand washing, but we should never forget to hand wash. It's certainly a challenge for myself, working as a scout leader, to make sure that all of our younger people, now we can have people on camps from the age of 6 all the way up to 16 or 17 years of age, and that includes adults as well. And getting some of the youngers to wash any part of their body can be a challenge. So sometimes it needs to be supervised. So you, as the healthcare provider or a healthcare professional or focal point, need to be looking and watching people and making sure that they are making an effort to stay clean. And if not, our job and our responsibility is also to educate people on how important personal hygiene is, especially hand washing, because we know that failure to wash hands can easily contaminate areas where other people might be and lead to the spread of disease. So, of course, there's going to be waste when it comes to hand washing, or any kind of washing for that matter. So we need to make sure that we keep at least 200 feet away from any water sources, so any streams or any other water areas, because we don't want to contaminate them. If you have it available, biodegradable soap is best, again, because we're looking after the environment. We can consider using sanitizing towels or wipes, but that just creates extra mess and extra rubbish that you're going to have to control. And these things are wet, so you're going to have to go through the process of drying them out before you can burn them and get rid of them. So I would advise not using sanitizing towelettes or wipes. Communal garden water with a proprietary soap is good enough. Towelettes and wipes, whilst they may be convenient for the person at the time, they're not when it comes to getting rid of that waste. Always, always, always clean your hands after going to the toilet. Always, always, always wash them before you eat, and always, always, always wash them when you are preparing food, etc. As healthcare practitioners, we know this, so there's no excuse for us not to do it or anyone else. I remember going on the ward, and as you go through those doors, the nursing sister would be sat at the station, and if she didn't hear the faucet or the sink taps running before you walked onto the ward, she would shout at you from the nursing station desk, because we always had a sink by the doors as you entered the ward, and you always washed your hands before you were allowed to touch those patients. It became habitual. So we need to make this a habit when we're living and working in the field. Food. So even in non-bear countries, so if we're in the US or various other places in the world, we may have concerns when it comes to large mammals, but food needs to be secured to keep it safe from other animals and pests. It's not just bears that want to raid your campsite and your tents. If you're in places like Africa and you're living in the field, certainly I know from the military, lions, they like to come sniffing around campsites. Hyenas If there's a free meal going, these guys can sniff it out from miles away, and they will soon come and investigate. Don't leave food sitting about the campsite. Do not leave food lying away. If you haven't consumed it, then you need to make sure it goes somewhere where it's safe, where it can be kept and used safely again, or it's disposed of safely. Keep food away from inside your living accommodation. Unless you want to wake up with somebody tearing down the side of your tent who's got big paws and sharp nails, then keep food away from the inside of your tent. Again, in non-bear country, you can still hang it in a tree, secure it in a food locker, or place it in a vehicle. It needs to be somewhere that's secure where these things can actually get to it. And you can have these things away from the campsite as well. Don't have it in the accommodation areas. Even in remote healthcare setting, in my oil rig, we are not allowed to take food into the accommodation area. Again, because food can go rotten, and we can get cross-contamination, we can get bacteria buildup, and people can quickly get sick, and that's the last thing we want. So it's not always in in a camping type setting. We can put this in various other environments. Never mix food with where people sleep. So here we go. Moving on to eating and cooking. Wash your hands. Make sure cooking and food utensils are clean. Biodegradable soaps can be used. Again, rinse well. Soap residue can still make you sick. Any chemicals that are left behind as a process of your sanitization of your living areas, of your cooking utensils, etc., that can also make you ill as well. Use boiling water when possible to rinse. The hotter the water, the better it is. Cooking pots or pans, especially if they've got non-stick surfaces. If any of you have ever been camping, especially on a scout type camp, it can be a full-time job cleaning pots and pans. Obviously, it depends on who's doing the cooking, but yeah, they tend to be non-stick, but they can harbor bacteria and they can harbor food waste. So a lot of effort needs to be made to keep our food preparation equipment clean. We don't want contamination of new food coming into contact with old food. So good cooking and cleaning processes are essential. So you may have to use alternative water sources. You may not have potable water that's going to come to you in your jerry cans. It may be water that you need to collect from a river or from a stream or some other water source, in which case you're going to have to go through water sanitization processes to make sure that that water is clean and potable and fit for human consumption. So we assume that all water you come into contact with in the outdoors is unsafe. There you go. And we take necessary measures to make sure it is safe. So again, assume all water you come in contact with in the outdoors is unsafe. That is a golden rule. Water filtration is the safest method to assure safe water. And there are various filters, ceramic type filters, that are capable of removing dangers of bacteria, giardia, and other waterborne type infections. There is no excuse to dip a cup in a river and take a swig of water. So looking at personal care, washing on a daily basis. You cannot just leave it, oh, it's fine, it'll be okay, I'll do it another time. You have to have a routine. No different than you would as if you were living at home in your normal house or your apartment or whatever. You need to wash your face, you need to wash your hands and armpits, especially those areas where you're going to collect sweat and bacteria. Now, if water is limited, because it may be, then rub briskly with a dry towel to remove any excess oils and perspiration. And actually, this can be very effective. We actually call it dry washing. There are certain soaps in inverted commas that you can use that facilitate dry washing, but essentially what you're doing is applying a sanitizer to the surface of the skin that will dry the skin out, help to remove the excess oils and any debris as well, any dry skin. Teeth, always clean your teeth at least twice a day, first thing in the morning and before you go to bed. And if you've got no toothbrush, there are alternative methods you can use. But remember, guys, it's about preparation and planning that prevents poor performance. So you need to make sure that you've got all of the equipment that you need to be able to live comfortably in the field. Underwear. It's got to be changed at least twice a week. I would argue twice a week is still probably not enough. And frequently I will see patients, especially in a field type setting, that have Dobie itch, what we would term as crotch rot, areas where they've just not changed their underwear and it's become soiled, heavily contaminated, and they need to make sure it's washed. And if you've got no water to wash, shake it out and leave it in the dry air for at least 2 hours. And we tend to find that it's that buildup of moisture that causes more problems. So you need dry, clean clothes, especially underwear. Wash your feet. At the end of the day, these are the things that keep us going. They transport us everywhere, and we must look after our feet. So wash them daily, and you've got to keep your socks clean and dry. So, you know, we say there, certainly in the military, there is a cure-all. You've got to have your feet powdered. You've got to have your feet dry. Your boots need to be clean, and your boots need to be dry. And we put a lot of effort into that because obviously an army marches on its feet. And in fact, one of my jobs in the military as an NCO was at the end of a working day or during operations is we would have a foot parade. And you can do this in a civilian type setting. You could do it in your research camp in the middle of the Costa Rican jungle. We can say, right, guys, we're going to have a foot parade at the end of the day. And as a healthcare provider, I'm going to come around and check all of your feet to make sure you're not developing the signs of foot rot. The last thing you would want is trench foot, which can occur. If somebody's got their feet in wet socks, in wet, damp footwear for a considerable period of time, it can cause some major problems. Wash your feet, keep your socks clean and dry, and use foot powders. Avoid using scented deodorants. So I know we said trying to live out in the field in a similar way that we do at home, but there are things that can cause us issues. So we want to try and use things that are not scented. Remember, we don't want to attract things. So especially insects, especially animals. So avoid using anything essentially that's perfumed. Aftershave, etc. Don't need to wear that. We're not trying to impress anybody. What we're trying to do is live safely and live cleanly. Don't bathe or launder, so wash your clothes in streams, pond, etc. with soaps. Again, we need to think about the environment. Carry water at least 200 feet away from the water source before you leave it. And don't dump it back into the water source all dirty and contaminated, because that's just going to make things even worse. Sleep and adequate rest is really, really important in a field setting. And remember, this is not always going to be that lovely bed that we're very much used to. There's a saying that there's nothing like your own bed. And I certainly know after I've been on my travels, you know, I'm really looking forward to a good night's sleep in my own bed. But when I'm working out in the field, that's not always possible. In fact, sometimes it can be quite a struggle getting any rest at all. If anybody's ever been in the jungle in South America, it can get pretty noisy at night, and that in itself can keep you awake. But your personal care also includes mental health, and we shouldn't forget that. It's not just about your physical health, it's also about your mental health as well. And sometimes people can struggle, especially younger people who are not used to being away from home. And in saying that, I've seen the same with adults as well. Sometimes adults can be used to a certain level of comfort, And it can be a rude awakening when you're in a field type environment when that level of comfort is not going to be afforded. And there are people that us as healthcare practitioners need to keep an eye on, and they might need a little bit of extra support, not just physically, but also mentally, to help them get used to living and working out in the field. Now, if no sleep, don't worry, sleep loss does no permanent damage to the body and mind. So I put a big question mark kind of against that, because I certainly know that if I'm not sleeping, my mental health is definitely going to be affected, and I'm not always going to be happy with everybody. So I think, again, this is one of those things that people say, it's fine, you'll always make it up later. Sleep is very important. So when we're choosing accommodation facilities and we're choosing sleeping facilities, we need to try and make them as comfortable as possible so that people are getting adequate rest. And that means insulating somebody from the ground. If we can do that on a cot or some kind of bed, that would be great. If not, having some kind of mattress, something that's going to provide a level of comfort or cushioning as well as insulation away from the ground. Remember, we can get a lot of heat loss if we're sleeping directly on the ground. So we need to make sure there is a barrier to aid restful sleep. Certainly in the field, we want to try and avoid using chemicals to help us sleep. Whilst it could be a short-term remedy, it's never a solution. What we need to do is address the issues in terms of why people are not sleeping and try and come up with a workaround so we can make the conditions better to allow for adequate sleep. And again, this is really important for us as healthcare practitioners because we need to be sharp, we need to be alert, we need to be capable of doing our job and maintaining good clarity and thought processes to be able to offer help to people in need. You need to protect yourself, so what you wear is obviously just as important. Ticks, flies, mosquitoes, rodents, insects can make your life a misery. So you need to select clothing and you need to wear it properly. Arguably, wear it as it is designed to be worn. It should never be modified in any way. Ideally, it should be loose but comfortable, usually in a double layer with the sleeves down. And that means long trousers and not shorts. Any exposed area of skin means you're leaving yourself open and vulnerable to things like bites and stings from flies, insects, etc. Of course, like I said, washing any uniform that you may have, any clothing that you've got, and changing it frequently, shaking it out to make sure any critters or anything that could have got in there, especially ticks, to make sure that they don't remain in your clothing and can cause you problems further on down the line. Whilst they may not be biting now, they wait for you to rest and maybe go to sleep before they do their bad things. Make sure you've got a good work rest cycle. You've got to build a routine into living in the field. Again, we're taking those living conditions from our urban setting and we're moving them into a field setting. Have a work rest cycle. And this is good for you mentally and psychologically as well. So here we go. Here's me on Scout Camp. And I'm going to introduce you here a little bit to camp life. Pretty rudimentary, pretty basic. And this is in the Czech Republic. And you may think, well, Central Europe, that can't be bad after all. There's nothing here really that's going to cause anybody any harm. But there is. So this really doesn't matter where you're doing it. Arguably, there are, some bigger dangers, especially if you're in the savannah, if you're in Africa or whatever. We don't get too many lions in the Czech Republic nowadays, but we do have wolves, we do have big cats, and there are things that can be attracted to a campsite that could make your life uncomfortable. But here we've got a good example of tentage, and we've got guys settling in to a camp, and they're actually on site for nearly 2 weeks, which is quite a long time to live in the field. At the back of our camp here, we've got our porta potties. So we've got our latrines, And these essentially are toilets, but they're not chemical toilets. They're just a means of collecting excrement. So urine and feces. We've got separate accommodation here. So we've got toilet facilities for both male and female. And we also have a tent to the side here, which is the lighter one in color, the bigger tent on its own. And we've created a facility for the female members of our camp, especially the younger females, because they can go through menstruation. And they're going to need to manage their menstruation, and they're going to need to manage the waste that is produced from the menstruation. But they also need an area where they're able to clean themselves privately as well. And that's what we also have to think about, is privacy. How can we provide privacy to our patients? How can we provide privacy to individuals? And again, this is an important part of the mental health as well. We shouldn't be standing naked in the middle of a camp having to do basic bodily functions where everybody can see us. We need to create facilities where we can have privacy to do the things that we need to do. But of course, that waste can't stay there. It's going to build up over a period of time, and we're going to need to move it at some point. So in this case, what we did is, amongst the leaders, or the adults at this camp, so we had around 40 to 50 adults. We would assign tasks to those adults on a daily basis. And one of those would be to clean toilets or empty the porta potties. So first photograph here on the left, we've got what we call a shallow trench latrine. And this is essentially a urinal for the boys. And this is just a question of going to the bathroom in the urinal and then just sweeping over some dirt that's heaped up on the opposite side of the trench, and that it buries it over. Now, these are only temporary. These are not permanent, and it may be necessary to move your latrines. But again, this is an adequate way away from the campsite. And you'll notice that we've used white barrier tape. And the reason we've used that is so that these facilities can also be accessed at night or in low light situations. What we don't want is people wandering off into a forest or having an incident or an accident because they were trying to go to the bathroom. And we've also got a pit here. So the idea of this pit is, when we empty our portable latrines or our porta potties, we're actually burying it deep in the ground. And we have a means of being able to cover that up as soon as the excrement has been put into there. And as I said, this is a good safe distance away from the campsite itself, so as not to cause any issues. So common problems, people are going to get bitten. So I've got a few examples here. Tick bites. So certainly for us in Central Europe, ticks are a big problem. Tick-borne encephalitis is a problem. And we actually have hospital wards in the Czech Republic dedicated to purely treating tick-borne diseases. And again, this is in Central Europe. This is not anywhere tropical. So these things apply in Europe just as well as they do anywhere else in the world. And as you can see, they're extremely small. But what tick bites can do is obviously cause issues like Lyme disease, and which can be extremely debilitating, can also be life-threatening as well. And most certainly on this particular camp, I spent quite a lot of my time removing ticks from the young people. And you have to make sure, and even when it comes to young people, you've got to educate them to make sure that they check themselves on a daily basis. So again, for adults, if we were again on a work location somewhere out in the field, we should be checking ourselves all over. And if we can't check ourselves, we should be getting someone else to help check us as well. And again, your job as a remote healthcare practitioner would be literally to inspect people's bodies to make sure that they're not suffering from any issues. When you've got something as small as an innocuous as the European tick here that can cause such major problems, it's definitely worth doing. Mosquito bites, they're a favorite. They can be very irritating. We've got a young person here who's got them on around their clothing that's rubbing, and then they in turn scratch them. and this can get infected. We can end up having open wounds. So using things like insect repellents is also a good idea as well, and checking and keeping an eye on people. Things can get an awful lot worse if we let them. Prevention is obviously better than cure. We've got a condition called shoe bite. So I talked about clothing already and how clothing can be ill-fitting, and that can be made worse by physical activity, especially if you're at a work site. So it's really important that whatever clothing or shoes, footwear that you have is comfortable and it's fit for purpose. Don't put on a brand spanking new pair of boots or shoes before any new physical event. You need to make sure that they're broken in. And if you can't do that, you're going to need to soften them. So you need to take pressure off of areas, and you're going to need to use padding. So again, this is myself treating a younger member of our group because he's got horrible blisters on the back of his heels because his parents bought him a new pair of hiking boots. Again, this can be very debilitating. And the last thing we want is infection and somebody becomes non-ambulatory as a consequence of this. Again, preparation could very well have prevented this. Make sure things are well padded. If you need to use things like antiseptic ointments, etc., you can do, but make sure you rest any affected part. And of course, if you need to, refer it to a higher level of medical authority for advice, or potentially evacuate this person. If it gets to a point where they're not fit to remain on site, get them to a place where they're going to be able to recover. Any part of any clothing can rub. Now, as scouts, if those of you are familiar, we wear neckerchiefs. But again, some of the younger people maybe don't wash their neckerchiefs very often. They usually leave it to their parents. But of course, they can get dirty, they can get sweaty. And in this case, we've got a neckerchief that has been worn and it's caused some irritation. It's been rubbing. The individual has scratched and scratched and scratched, and they've ended up with a very nasty, itchy kind of rash on the back of the neck that's actually got quite painful for them. And in fact, this young individual was actually quite distressed by this. So we needed to put something on there, cool, sterile water to help cool it down, get rid of that irritation. And then we used an antiseptic ointment, and we told him that he didn't have to wear his scarf until such time as we had some healing. So pat it out if you need to, cover it, because again, we don't want it to get infected and we don't want to get any more dirt or anything like that into it. Insect bites can obviously cause irritation and itching, urticaria. Again, an allergic reaction to insect bites. Prevention, simple, stay away from the insects. And they can come uninvited though, unfortunately. So we need to protect ourselves, and that's where the adequate clothing and clothing selection comes. Treatment, we can keep these things simple with soap and water, and a lot of hygiene and sanitation really boils down to cleanliness and soap and water. Use ice if you have access to it. We can use things like ice packs as well. We can get these chemical ice packs that can be used that can actually be very effective in a field type setting. But if you've got any irritation that could lead to anaphylaxis, then obviously you're going to need to take higher measures. And that's the thing to be mindful of, is medications or people that do have allergies. I'm going to touch on that as we progress. Certainly in hot, extremely hot environments, we need to be mindful of heat exhaustion and heat stroke. And again, it's all about prevention. So making sure there's plenty of rest in between periods of activity, making sure that people are taking adequate water intake, least amount of stress possible, and obviously they're eating and they're drinking properly. And that does also tend to change when we're in a field environment. What we don't want is heat exhaustion leading to heat stroke, because obviously that's going to become an emergency, and to manage that out in the field can be extremely challenging. Prevention is always better than cure, and we need to make sure we ensure adequate water intake, wearing the right clothing, and making sure we've got rest, good sleep and stress. Sorry, somebody's got their mic on there. Quite a bit of background noise. Just check your mics. So treatment, loosen and remove any clothing, especially if you've got somebody who's overly hot. You're going to need to cool them down. You need to get them into the shade and in a cool environment. And we can use active water spraying and fanning and water to drink. Sorry, can I ask you again just to check your microphones and put yourselves on mute? Okay, thank you. If you do have somebody who is unconscious, then obviously you can't give them water orally, and there's other methods you're going to need to use to rehydrate patients. So that may mean IV access and IV fluids. But the last thing we want is things to develop into the emergency, and this is really all about preparation and planning and prevention. Fungal infections, again, cleanliness, skin, contamination, washing, all prevent skin-related issues. Keeping clean, bathing daily, cleaning susceptible areas with greater care, thorough drying, using your foot powders, frequent changing of underwear and your socks and your clothing, and airing of affected areas. We need to let your skin breathe. If we do get any issues, especially when it comes to fungal infections, we've got to clean those areas and keep them clean. No shoes or socks, airing the feet, using things like your foot powders, ointment applications. Personally, I like drying things out. If we put ointment onto things, it can keep things wet. And having wet things is maybe not so bad when it comes to wound healing, but certainly when it comes to fungal infections, that's just going to make things worse. If needs be, take pictures of something that you're not sure about. Send it to somebody who's a dermatologist, somebody who can give you a bit more of a definitive diagnosis that may help you when it comes to treating skin conditions that you don't recognize or you're having trouble or challenges managing. Stomach-related diseases are common, especially when it comes to poor hygiene and food and water contamination. So we need to make sure we've got good routines when it comes to food and water, and certainly adequate amounts. Good food handling practice and good food disposal practice, following our daily routine, especially when it comes to disposal of human waste. There's no excuse not to empty those porta potties on a daily basis. Drinking plenty of water, of course, is going to stop people being dehydrated, but don't miss meals. We need to make sure people are adequately hydrated as well as well fed in a field type environment. UTIs can also be common as well. And again, prevention is down to water intake and adequate intake of water. Plenty of fluids. So just a quick one before we finish off about medications. So here in our cook tent, we've got medications for all of our younger people, including adults, and we've kept them in a central location that's manned all the time. So as one of the leaders and supervisors, I'm not always going to be in a medical tent. I might be out doing one of the activities or doing another role other than just the kind of focal point for medical things. So the cookhouse is usually a good place where somebody's going to be all day. There's a lot of effort goes into preparing food, and that means somebody's usually in that location, in which case it's usually a good central location for people to go and collect things. So whilst we can't always trust younger people, this does include adults, to look after their medications, if we can stow them in a place where they can be kept an eye on and that they can be secure. And then what we do is maybe at breakfast or certain times of the day, because we usually give medications routinely on or around meal times, is we can actually make sure patients or people in our care are getting the medications at the right time of day. Things like EpiPens, if we've got somebody for anaphylaxis. Hopefully, they're going to be carrying that with them. But if they don't carry it with them, excuse me, we need a central location to be able to collect it and use it quickly. Just bear with me a second. Here's my little clinic. Very basic and rudimentary. I've been talking all day to my students, but I've got a very basic medical kit there. And again, just to be able to manage my my patients. And really, to round things off, the message is this shouldn't be something new. Preparation and planning prevents poor performance, especially when it comes to living and working in the field and looking after other people. As healthcare professionals, we need to make sure that we can also look after ourselves as well as the people that we're going to be in charge of. And the younger we can start people and start educating people on how to be self-reliant and how to be able to live in the outdoors as well as in the urban environments we're used to, the greater our chances of survival and living comfortably in a field type environment we're going to be. So that's the end of my lecture today. Again, thank you very much for your time. I'll stop the presentation. I'll open the floor up for questions.
There were a couple of questions in the chat.
Okay, so let me just open up the chat. Sorry, I was unable to follow that. A couple of guys have had to drop out. That's okay. It is being recorded, so that will be available to you to watch after this. Any further reading sources on these WhatsApp type topics? Carl, the answer is yes, but what I will need to do is I will need to produce a list of these and add them to the link that you'll get in LinkedIn and our other social media pages as something after this. So whilst I don't have them off the top of my head, I will make sure I write that down and provide those resources after this lecture, if that's okay. Anything else from anybody else? I mean, this was very basic, and you know, you can go into depth with this, but really it's just an introduction. You need to get used to living and working in the field. It is not the same as being in a nice, clean, bright hospital, oil rig or whatever. It's very, very different, and the environment is very, very different. And arguably, you need to be able to look after yourself, stay clean, stay healthy before you can look after anybody else. Thank you, Godlove, for the comment. Anybody got any other questions? I like the jungle. It was a massive challenge. I totally agree with you, Jamie. Most certainly being in Costa Rica, I actually came away from Costa Rica with ringworm infection. So I spent a lot of my time lying on the jungle floor, taking photographs of ants and crawly things. Fascinating. But I was wet all the time. And despite my, what I would have considered good night routine, so in other words, all of the wet clothing that I had on during the day, I would take off and I would just hang that up and hope that it would dry as best as possible. And then my dry clothes, I would take out from my bag. I put my dry clothes on, and those were the clothes that I would sleep in. And the idea being is then I would hang those clothes out to dry, and then I would put my wet clothes back on. But when you're doing this for a number of weeks, it takes its toll, and inevitably your dry clothes just end up wet. Everything just ends up wet. Sleeping material, that ends up wet as well. So you need to be using things like fires. Good old wet dry drills, absolutely. Drying your stuff out, having it next to a flame. So you think, well, why on earth would I want to light a fire in the middle of jungle when the ambient temperature is in the 30s to 40s? But with 100% humidity, you need to make sure that you dry everything out as much as possible, because if you don't, it's going to come back and bite you. And the last thing you want is foot rot, crotch rot, or some kind of deep infection that you're not going to recover from. Thank the Lord for hammocks. I totally agree. Sleeping off the ground is absolutely key, especially when you're in the jungle. I've actually become a convert to hammocks. I haven't really slept. I've usually slept on a cot or something similar. But yeah, hammocks most recently, within the last couple of years, I've been using, and a much better night's sleep. And my gear as well, it's off the ground. I'm able to hook up my rucksack at the end of my hammock. That keeps everything off the ground, stops creepy crawlies getting in. Everybody else who's in the tent on a ground sheet, they are getting tick bites on a daily basis, and I'm spending my time taking those ticks off of them. Me, because I'm off the ground, those things are not crawling into my bedding at nighttime, and that really makes, sorry, during the daytime, and that really makes a difference. Keeping off the ground is arguably key. Thanks for that. Check your boots. Things crawl into your footwear, and we usually take them off at nighttime. Shaking out footwear. Things like scorpions, things like snakes and other creepy crawlies and things, they can get in your clothing. Turning out your bedding to make sure that there's nothing inside. Obviously, be careful where you put your hands. Scorpions do tend to climb inside of sleeping bags. They like it. What's that? There's a tip there. Put the socks over your boots. Yeah, if that stops something getting inside your boots, absolutely. Why wouldn't you do that? Yeah, good. I like that one. Thanks, Jamie. You're welcome, John, from Florida. Any other questions, guys? Everybody happy?
Well done. Well done, Tim.
You're more than welcome. It's experiential. You've just got to go and do this. You've got to learn, and you've got to take your job, take whatever it is you do, and then try and transfer it to the field. And it's different. But you've got to be able to look after yourself. And I think that's the thing. That's the main thing, is your own self-reliance, because you're not going to be able to look after anyone else unless you can look after yourself first. The scouting organization is obviously a good place to start. I've been a scout for many years now. I started off as a youth, Cubs and Scouts in the UK, and I'm now still doing it throughout my adult life. But it's a perfect opportunity for me to pass on and educate younger people. And hopefully that's something that might interest you guys as well. We can pass on our skills and our knowledge, which is going to make a big difference. In that case, then, guys, I'm going to ask Ebrick to stop recording, and I'm going to thank you very much for your time today. And I look forward to the next opportunity when I'll be talking to you. Thank you very much for your time.
Cheers, Tim.
Thank you.
Thank you, Tim.
I'm usually the one that hangs on to the end and waits for all of the boxes to go blank, just in case anybody wants to ask any question. I'm offshore and it's scoff. Enjoy, mate. I've got to go and get my dinner as well. I shall ring the wife before I do that.